Millions of people worldwide struggle with food and environmental allergies. That's what today's episode of the Medicinal Herbs podcast is about, and we're happy to welcome back naturopath and herbalist Joe Boyd to have this important conversation with our host, Sarah Lebrun-Blaschka.
We are so excited to have Joe Boyd back with us today to talk about allergies and those seasonal irritants that we have and really, how they come about, what can we do, how can we herbally treat them, and really kind of get into that. So, Joel, it's really interesting because, when we look at some of the literature, we're seeing that there's really an increase in allergies and other sensitivities, if it's food or otherwise. Why do you think this is happening? Why is there now this sudden increase over the last few years?
Yeah, you're absolutely right, Sarah. And I think, as you said, sensitivities of all kinds really have shown this clear acceleration over the past couple of decades. They're becoming an increasingly common, and I think at quite an alarming rate. And we are definitely seeing this allergy explosion, as I've heard it referred to. And there's a couple of theories and factors to consider for, this increase that we're seeing. And I think one is environmental and pollution and this ever increasing toxic world that we're living in, and allergies just being a major response to that. And our changing environment really has become this paradise for pollen. We're seeing warmer climates, and as a result of that, we're not only seeing significantly increases in pollen levels, but we're also seeing earlier and longer pollen seasons, which is resulting in, this dramatic increase in allergy rates, but also allergy sensitivity as well. And I think, that's not welcome news for hay fever sufferers, because that romance of spring, when we all come out of hibernation and the days get warmer, that quickly wears off when the sneezing starts and the runny noses begin. So that's one aspect of it. Another one is dietary changes and the alteration we're seeing in gut microbiome and gut health. And there is this increasing amount of information showing that microbiotic changes can affect not only immune modulation and inflammation, but of course allergies as well. And there's another theory that I think is particularly interesting, and that's that we've got less exposure to microbes, and it's all about this hygiene hypothesis. So this theory is that there's that critical postnatal period of immune response and immune development in little ones and newborns. And the theory is that that's being derailed by the extremely clean environments that are found, particularly in the developed world. So basically, we're too clean to pose an adequate or effective challenge to the maturing immune system to really educate the developing immune system and educate it in a way that it can become proficient and learn to launch its defense mechanisms and so forth, not only throughout the early days in childhood, but through to, adulthood, so the rest of the little one's lives. So there's quite a few theories, and there's more theories than I've just mentioned, that I think are interesting, and it's certainly worth exploring.
Can you maybe expand a bit on this idea of atopic allergy and what does that really mean?
Yeah. So atopy is a major predisposing factor for the development of things like eczema or atopic dermatitis, asthma, allergic rhinitis or hay fever, and also food allergies. So those four common hypersensitivities that we see. And it's considered to be typically a type 1 hypersensitivity. Most often there seems to be some type of genetic or hereditary disposition to the development of some type of allergic reaction and the tendency to develop those IgE antibodies. And there's a theory called the atopic march. And this is the progression of these atopic disorders that I've mentioned from, infancy through to childhood and through to adulthood. And the theory is that irrespective whether it's atopic dermatitis, asthma, food allergies, and so forth, that very first sensitization to the allergy actually occurs via the skin. So it's really important with newborns and with little ones to support healthy skin barrier function from a very early age. And I think if we can get in early enough, we can potentially prevent these challenges from progressing. And I think, in regards to skin barrier function, what seems to be compromising it, and it sort of ties in with that whole hygiene hypothesis, is the fact that, we're bathing our babies too often. So frequent bathing, the use of, harsh soaps, and creams and shampoos and things, particularly with sodium lauryl sulfate, really strip that protective barrier. And then, in addition to that, of course, we've got, the fact that we tend to live in this concrete jungle. Well, a lot of people do anyway, where we're exposed to air conditioning and heating, which can further really impair that all-important skin barrier function. So I think that's a really another interesting theory to look at when we're looking at supporting and, hopefully preventing all of these different types of sensitivities.
So, we often see many of our patients that we're working with have, some type of allergy or sensitivity. And as we're doing that, what are some of the key concepts and strategies that you implement in your practice to, work with those patients? Because, we want to make sure that we're finding ways to support them, but, also finding ways to, because usually they're coming in for something, not only their allergies, right?
That's right. And as always, there's not one size fits all scenario. And in regards to treating allergies and atopies, it can be really challenging. And I think it's important that we look at addressing allergies as a complex mosaic of factors that can be contributing to every individual case that's presented to us in clinic. But some of the overall things, and I think the commonalities that we see and we can address, firstly, is to minimize, environmental triggers where possible. So looking at reducing the toxic load in your home, looking at whether you've got exposure to dust mites and molds and pet dander, reducing, and once again, this is if possible, your exposure to pollens and air pollutions. And also, I think it's really important to observe a healthy diet low in potential allergens, of course. I think another big one that I previously mentioned was all about barrier function and barrier integrity, and really reducing the barrier stresses that we seem to be bombarding our bodies with. So in regards to epidermal barriers, they do face harsh challenges in modern day life. So we need to look at appropriate herbs and whole foods and probiotics, of course, to support barrier function. And it's not just the skin. We need to look at the respiratory and lung barrier function, think about intestinal barrier function, of course, as well, and the microbiota, which you could consider an ecological barrier. And all importantly as well, we need to reduce those symptoms because they can be very consuming. At times they can be painful. At times they can really take over someone's, world and ability to function. So by reducing symptoms, look at stabilizing mast cells, reducing histamine, and really dampening down that allergic response. And there are certainly some really valuable herbs that we can use for that. And then, as I said, there's many things to consider, but looking at gut flora and gut function, immune modulation, reducing inflammation, supporting the NRF2 pathway, there are many things that we need to look at and support. So as I said initially, we really need to consider a mosaic approach when we're looking at helping our patients with allergies.
I really like this, the concept you brought up about barrier function. And I think, in my past, I really think about that, the leaky gut aspect, and that really does have that significant impact on allergens, right? Specific
Absolutely.
food allergens. So
Correct.
I think that's key. And then if we think about it beyond just the gut. So, we talked about, kind of like, there's a variety of ways to support these overall functions and go to from probiotics to, herbs and other whole foods. But, if we think specifically to allergens, what are those go-to herbs that you're thinking about with your patients?
Oh, look, Sarah, there are so many options.
Right.
But I think about if we're looking at, say, for example, dampening down that allergic response, stabilizing mast cells and reducing histamine, which is an essential part of an effective treatment plan. My two favorites would be albizia and black cumin seed. And in regards to albizia, it's an old herbalist friend. It's been a favorite for herbalists for many, many years for sensitivities of all kinds. And it's a herb that's renowned in Ayurvedic medicine as being a potent anti-allergic herb, and it's said to clear toxins from the head, I think, which relates to its use in upper respiratory allergic type challenges. It's also said to have an ability to strengthen the lungs and clear excessive mucus, so it's really going to support clear and free breathing in health challenges such as perhaps asthma and bronchitis. And in addition to that, it's also being used to and said to be effective for skin sensitivity. So it's got a long history of use in providing relief for eczema and other type of skin challenges, and also conjunctivitis. So, as you can see, it really is, it's a great all-rounder. And as I said, an old favorite for dampening down that allergic response, and particularly effective in acute situations where there's a rapid onset of symptoms. And my other favorite, as I said, was black cumin seed, which I think is a really interesting herb, and where we seem to be learning more and more about black cumin seed over the years. And what's interesting is it has some of the best clinical evidence for any herb in atopic conditions. It's been cultivated for over 3,000 years for a multitude of uses, and it's a herb that really is steeped in history. And people who may be familiar with black cumin seed may know that it actually, healers had referred to it as the seeds of blessings, and claimed that it could be used as a remedy for all other diseases except death, which is a very impressive list of applications. But in regards, coming back to our discussion today, in Western herbal medicine, we do consider it to have anti-allergic activity and antihistamine activity. It also has that bronchodilatory effect, and also anti-inflammatory and antioxidant support. So once again, it's a very good all-rounder for all of these different types of sensitivities. And studies have shown that it does help to improve symptoms of allergic rhinitis, like reducing that irritating nasal congestion and sneezing and itching and that post-nasal drip. And I think what I also really like about black cumin seed, because it does have anti-inflammatory activity, is that it upregulates interleukin 10. So often when we're looking at allergies, we're talking about down-regulating inflammatory cytokines, but in particular black cumin seed, and Bicol skullcap's another herb that it will do it. It upregulates interleukin 10, which is a potent anti-inflammatory cytokine that will help to really down-regulate that allergic reaction. So as I said, I find it a very fascinating herb, and certainly I think we'll be learning more and more about black cumin seed in the future.
As you're talking about kind of a specific areas, and I think black cumin seed is one that's like growing in many, many conditions, and including allergies. But as I think about like maybe a patient that comes in, maybe specifically, you started to talk a little bit about rhinitis, but if I had allergic rhinitis patient, what would be that recommendation that you would think for that individual?
Sure, and it's certainly something that we're seeing an increase in people experiencing allergic rhinitis. The first thing I think we must, where possible, reduce our exposure to those triggers. So with allergic rhinitis, it can be perennial, where people have it throughout the year. And usually we see that that's caused by things like dust mites and animal dander and mold. So I think first, start looking at the home and where we can really lighten that burden and those triggers. And then it can be seasonal. So as I said, spring's typically considered a delightful, time of year, but that's not the fact for allergic rhinitis sufferers or hay fever sufferers. And I know that there are particular states, for example, in the US, where the pollen counts are much higher. So something to be aware of if you are considering moving, for example, and do have that tendency or predisposition to hay fever. I think a big one as well is we need to look at reducing the symptoms as well, because it can be incredibly debilitating for someone. So stabilizing mast cells and reducing histamine And the key herbs for that are albizia and black cumin seed that I've mentioned, and other herbs to consider, some of my other favorites, Bicol skullcap and also nettle leaf. And barrier function, as we talked about previously and how important that is in regards to barrier protection in allergic rhinitis. Our mucous membranes in our upper respiratory system are our first line of defense, and they create that physical barrier to allergens and other environmental factors as well. So from a Western herbal medicine perspective, what we look at is support for mucous membranes. So be it eyebright and goldenrod, which are my two favorite mucous membrane tonic herbs for the upper respiratory system. And of course, another go-to, and I'm sure all the listeners are familiar with golden seal, being the mucous membrane tropho-restorative. So, I think it's really important to look at the tonicity of the upper respiratory mucous membranes, because they are our first line of defense. And I think if you can get in early enough to support barrier function for someone who does have these seasonal allergies, allergic rhinitis, hay fever, whatever you want to call it, if you can get in, say, even if it's just 1 month prior to allergy season, I've seen it happen, and it can significantly help to minimize the severity, for example, of the signs and symptoms of allergic rhinitis. So just there's some key things to think of. Of course, we need always, with any type of allergy, need immune support. So we'd use herbs like echinacea or astragalus or medicinal mushrooms. Looking at gut function, I mean, Sarah, you always previously mentioned, the importance of looking at healthy gut function and healthy gut barrier function. So that may be, and I'm sure everybody's got their go-to protocols for that, but it could be a weed seed feed protocol, and also bitter herbs, because bitter receptors, we know, are found throughout the body. They're also found in nasal mucosa and also the smooth muscle cells of the lungs. So eating bitter foods in your diet, or looking at herbs like gentian and wormwood and feverfew can be particularly effective. So, there's many things that we can do to really, I think, have an impact and reduce the severity of the signs and symptoms for our patients in regards to allergic rhinitis.
I know I have seasonal, and it's very specific to a specific type of pollen. And I do find that eyebright and goldenrod and golden seal have been something that's really, affected me. And my husband is one of those allergy sufferers who suffer no matter when it is, and albizia has helped him, just amazingly
I think
in his struggle. And, he was the kid getting allergy shots and those type of things. So
it can be really debilitating, and it can really affect someone's quality of life. And we don't always have the choice, do we, Sarah, as to where we live. So we can't always remove ourselves from that environment. But that's the beauty of herbs and whole foods. We can really have such an effective and meaningful impact in regards to allergies, for example.
Right. We can't all live in the desert. And I don't know that even if that was the best for me, I would want to live there. But no offense to those people living in the desert. So what about another typical patient maybe who has atopic dermatitis and comes in and says, hey, how can you help me with that? What would be your go-to for atopic dermatitis?
Oh, look, with atopic dermatitis, it can be really quite challenging to address and support our patients with. And I always think, what's that saying? Under promise and over deliver. So really help to manage their expectations. And it's the most common skin condition that we see, particularly in children. And it's said that 1 in 5 children will experience atopic dermatitis, where it's 1 in 50 adults. So what we really need to do is improve the skin's response. So the skin's our largest area of elimination. So we need to support all areas of elimination in the body to lighten that burden on the skin. And there's some beautiful herbs that we can use that really help to encourage the healthy function of the organs of elimination, and also help to support normal flushings of toxins from the body. And often they're our lymphatic and depurative herbs. So herbs like cleavers and sarsaparilla, burdock and yellow dock are some examples. And also, of course, it's essential to support that skin barrier function. And one of my favorite herbs for supporting healthy skin and really healthy tissue anywhere in the body is gotu kola leaf. And this is a key herb. And then I'd be looking at backing it up with herbs like grapeseed or ginkgo to help with, circulation and capillary integrity as well. So I think they're a really good combination for supporting healthy skin barrier function. And if you are using creams, avoid those aqueous creams or lotions. You really need to use rich emollient creams, or even I really like ointments, because what they do is they help not only to support the skin integrity, but they can work as a bit of a barrier support themselves as well. And then modulating histamine and modifying that histamine response and reducing mast cell activation with the herbs that I've already mentioned, albizia, nigella, biacal skullcap, and nettle leaf. And I think that's really important, along with supporting barrier function to decrease the pruritus or that itching and really help to stop that itch scratch cycle that people with atopic dermatitis get. Stress is another big trigger, so we need to look at stress. I'm sure everybody's got their favorite herbs for nervous system support and stress support. And immune system support, as I've mentioned, is always essential when we're looking with any type of atopies or allergies. And also look at gut health and microbiome colonization. So, for example, staph infections are particularly prevalent in people with atopic dermatitis. Is up to 90% of sufferers will have it. So, herbs like echinacea and myrrh and golden seal and looking at probiotic support is really important. And then, and I think this is common sense, look at healthy fats and oils as well. Cod liver oil, my little one who's almost 2, every night I give him cod liver oil and probiotics in a bit of lactose-free yogurt to support his skin and gut barrier function as well. So there's lots of things that we can do. And as always, look at the contributing factors and what could be a provoking factor and avoiding those, or an exacerbating factor. So diet, food allergies, and atopic dermatitis kind of go hand in hand, particularly in little ones. Up to 80% of infants, will have some type of positive food allergy test. So we need to look at that and reduce that where possible. And I think finally, I always like to remind people that herbs can work brilliantly topically as well. And I think atopic dermatitis is a great example where we can use herbs topically. So we look at the demulcent herbs like chickweed and aloe vera can really help to reduce that itching and some of that inflammatory pain. And then some of my other favorite herbs to make creams or ointments out of is calendula, because it's astringent. So, when we see that broken and damaged skin and sometimes that discharge, calendula really helps to promote healing, and it also has antiseptic activity as well, so an anti-inflammatory activity. So it's definitely worthwhile considering as part of your topical application also. So look, there's many things we can do, and as I said, allergies and sensitivities really need to be addressed as this mosaic health challenge. But these are just some options and things that I commonly will do when I have patients that do present with either atopic dermatitis or allergic rhinitis.
Jo, thank you so much for that. Is there any other kind of last words you want to say on allergies as we think about it in regards to herbs and as we close up our discussion today?
In regards to herbal support, that, it can be incredibly effective for addressing all of the various challenges that we see with these different type of atopies with our patients, not only by using them internally, but using them topically as well. And I think don't underestimate not only how effective they can be, but how quickly for many people they can provide relief as well. So sometimes I think it's about, managing the dose, and also, of course, looking at diet and lifestyle and all of those triggers that, these people with atopies or allergies continually seem to be challenged with.
Yeah, it's a complex situation with allergies, I think. And thinking about how you eliminate and then how you can support those individuals is really key. As I was reflecting on our discussion, I thought back to my I love Paul Simon, the artist, and he has a great song about allergies. It's called Allergies Popping in My Head. So
Really?
as I reflect, and you'll have to check it out, Paul
I'm
Simon's
going
song about
to. I'm
allergies.
going to, yeah.
With that, we will find the right herbs to help us with those specific allergies. And thank Jo for her time. And we look forward to our next conversation.
Thanks so much, Sarah.
Thank you to everyone who tuned in to the Medicinal Herbs podcast this month. For more education, visit WholisticMatters.com. That's holistic with a W.